We're going to be doing the quadrant test. For the quadrant test, we're going to be testing for the meniscus. And the first portion of this, we have two portions, the flexion and extension portion of it. So how we're going to do this is we're going to grab the heel and we're going to control the whole leg. So for the anterior portion of the meniscus, we're going to start in a little bit of flexion. If you want to find the anterior medial portion of the meniscus, you're going to palpate for it at the joint line. Then what we're going to do is we're going to internally rotate and then go into extension. Boom, boom, boom. If you have any pain, catching, or clicking, that is a positive sign for anterior medial meniscus tear. Then for the anterior lateral, what you're going to do is same thing. Start into flexion. You're going to palpate the the lateral anterior joint line. You're going to externally rotate, and you're going to go into extension, forcing it into extension, and you will have the same signs and symptoms. Now, for the posterior portion, you're going to start more into extension. For the posterior medial, what you're going to do is palpate the posterior medial meniscus, really dig into the joint line, and you're going to go into flexion, but with external rotation. So external rotation and flexion, posterior medial meniscus. Then, for the posterior lateral meniscus, you're going to palpate the joint line again. You're going to internally rotate, and you're going to go into flexion. And for these, if you have any pain, catching or clicking, this will be positive signs.